delayed cord clamping is something that a lot of people know they should do, and if you don't, watch our video about that. But there's a lot of misunderstanding about it and beliefs that are maybe true, maybe not true, that we hear people comment on videos that we've done about delayed cord clamping. So we're gonna go with Heather today, who's a midwife, nurse practitioner, and registered nurse, and she's gonna set the record straight and let us know things that you probably have heard about delayed cord clamping, whether they're true or partially true or completely not true at all. I'm Rachel from the Mighty Mama Movement, a mother of 8.
And I'm Heather, a family nurse practitioner and midwife.
Okay, so we're just gonna go one by one through a lot of things that you may have heard, and she's gonna explain it for us. Does delayed cord clamping cause jaundice?
So a lot of people, I've heard that through the years, and a lot of people will say, oh, delayed cord clamping causes jaundice. And they're saying that because we have a lot of red blood cells, or baby has a lot of red blood cells in the placenta when it is born. Mm-hmm. And a lot of its blood volume is there, in fact, 1/3 of it. And so when you cut it, you're actually making an anemic baby. And so they say, oh, well, you must get all of these extra red blood cells. And there is the potential for a baby to have jaundice, but some level of jaundice is normal. Mm-hmm. And the risk that your baby would get severe jaundice from delayed cord clamping is incredibly small, just incredibly small. And I think it is more advantageous for the baby to get more of its blood volume and not have anemia than it would be to have the risk of jaundice. Jaundice is easily solved. Mm-hmm. It's, you do the Billy lights, the Billy blanket, the Billy bed. And here's the thing, this is not scientific, okay? But of the 1,000 births I've done, not one baby has had polycythemia. And I do delayed cord clamping on every birth. It is very, very, very rare that we don't have a delayed cord clamping. Mm-hmm. I've never had a baby with polycythemia. And I've only had, I would say, less than 10 babies that have ever needed Billy bed, Billy blanket. And out of 1,000, I think that's pretty good numbers. And our delayed cord clamping isn't the 30 to 60 seconds right. that ACOG talks about. We're talking 5, 10, 15 minutes. And we have not had issues at all.
So is this something that people are just saying? Because we get this comment a lot. We've done other videos about delayed cord clamping, and that's probably the number one thing that people say, oh no, it will cause jaundice, you shouldn't do it. Is that backed by any research, or this is just sort of anecdotal because we've heard that it increases the risk?
It's very anecdotal because there are so many other things that increase the rate of jaundice, like the vitamin K injection can increase the rate for jaundice. Pitocin in your birth, not Pitocin for a hemorrhage, but Pitocin to augment labor or to induce labor, that increases the rate of jaundice. There's so many other things that increase it.
They wouldn't be able to isolate that one factor in research even if they tried.
It'd be very hard.
Yeah.
It'd be very, very hard.
And I will say also anecdotally, a lot of people have commented on those comments that it can cause jaundice and said, well, I didn't do delayed cord clamping and my baby got jaundice.
Exactly. Exactly. And I think my numbers are pretty good, having over 1,000 babies with delayed cord clamping, and not a single one of them has ever had serious jaundice.
So,
not one.
Moral of the story, even if it might increase the risk of jaundice, which there's no research to conclusively say that it does, it's worth the risk to get those benefits of doing the delayed cord clamping.
There are definitely more benefits than there are risks.
Mm-hmm. All right, the next one is you cannot do cord clamping if your baby needs resuscitation or any emergency care right after birth.
This is where the research strongly disagrees. So we keep that cord attached in a resuscitation as long as we possibly can.
And by we, you mean you.
My team, yes.
Unfortunately, that's not talking about we in general as all doctors.
Right, yes, my team does. And the reason we do is with every passing minute, the oxygen saturation of baby's blood coming from the placenta goes down, okay? and baby needs to start breathing with their lungs. But of course, if we're doing a resuscitation, they're not breathing. And we resuscitate babies at on mom's chest. We've resuscitated them if she's on a birth stool. We'll put a nice warm towel down between her legs, and we will resuscitate on the floor that way on the pad. And the towel will resuscitate on the bed, because every minute that we can keep that cord attached, and even though the oxygen saturation is going from 60%, which is what a baby is in utero, to 40%, to 30, going down, that is better than 0%. Once you cut that cord, it's at 0%. The reason they cut the cord in the hospital and they say, oh, we can't resuscitate, is because they're not willing to resuscitate on your chest. They're not willing to not have your feet in stirrups.
They want to get the baby right over to the little table.
So they've got to go to the other side of the room.
Yeah.
And in order to go to the other side of the room, they have to cut the cord. Well, now baby is getting 0% oxygen, and they are relying 100% on their resuscitation efforts. And plus they have made baby anemic now. They've cut the cord immediately. Baby has lost 1/3 of their blood volume that was in the placenta. And so their red blood cells are even less, and that's our oxygen carrying, the ferritin there, the red blood cells carrying that, and it's gone down even more. And so you will have a better recovery and a better resuscitation if you don't cut the cord and resuscitate with baby still attached. The only exceptions to this are obviously if there is like a little tear in the cord and you've got this little, blood spurting thing happening, or if the placenta has already come right off the wall, which the placenta usually takes at least 5 minutes to deliver. Every once in a while, a placenta comes on, follows baby's feet out, but that's pretty rare.
Okay, so if a mama is going to be giving birth in the hospital, there's always a chance that your baby may need to be resuscitated. Does she have the option to tell her medical team beforehand, if my baby needs to be resuscitated, I want him or her to stay attached to the cord, or will they just not even consider that?
So yes, you can always say that, but unless they've been trained how to do that, you're going to discombobble them, resuscitate a baby on mom's chest, and the best positioning to do that way. And then they kind of get in each other's way. And so unless they've been trained how to do it, they're not going to resuscitate your baby very well at all.
Okay.
So it's kind of catch-22 that way. You can ask them to do it, but if they don't know how to do the job,
that's not going to work out either.
Right, exactly.
Okay, the next one is you cannot do delayed cord clamping for a premature baby.
And that's actually one of the best times to do it, because premature babies are anemic typically because they cut that cord right away. So premature babies need a lot of blood draws, testing, and they need a lot higher of medical care depending how early baby is, the 35-weeker compared to the 28-weeker. And if you can give them all that extra blood, they're absolutely going to need it. And remember, we talked about in another video, when you cut that cord, the oxygen supply is immediately gone. And a premature baby has immature lungs. And so you have to go straight to resuscitation. Well, every second you can give that baby when it's born blood that is oxygenated through the placenta, which you can't give it very long, but every second is a second that you don't have to worry about oxygen coming from another source, and it gives the baby time to open their lungs. Blood volume is, and all of this is part of baby opening up their lungs. And so everything that happens with a premature baby over a newborn baby is much slower, not quite ready, usually a little immature. So you are making sure the baby has enough blood, because you're guaranteed premature babies, they're going to be taking blood. They need everything they can get. You're going to be giving them more red blood cells, more iron stores, because babies typically don't get iron stores until the very end of pregnancy. So whatever is there, they need. And that, but most of all, it's that oxygen exchange while we're waiting for their lungs to open up, or trying to manually open up their lungs because they're so premature. They're at least getting a little bit of oxygen from the cord while they try to get their lungs working.
Okay.
So the hard thing is we go back to the incubator's on the other side of the room.
Right.
And mom is here. We have to get baby from point A to point B, and they're not trained to resuscitate a baby right next to mom. And it's really quite sad because, you know, you are going to have the rare baby with a really short cord. But most babies, their cords are long enough you can put them on mom's chest. Well, if you can put a baby on mom's chest, you could put them right next to mom, and they could do a resuscitation next to mom.
Right.
But it's just a lot easier to put them on the other side of the room.
I think it's worth trying. If you know you're going in to deliver a premature baby, I think it's worth trying to talk to your doctor to just see, because I did an internship in the NICU, and so I've gone and observed resuscitations when they called in the team from the NICU. And it just doesn't even occur to them. They don't think about it for 1 second to keep the baby attached to the cord. But if you know you're going in for a delivery and you're delivering a preemie, you could talk to your doctor and just see if they'll consider keeping the baby there on the bed with mom and resuscitating there. They might be willing.
Yeah, it's worth, you know, the thing is, if people don't ask for it, it's never going to change. It's just not going to change.
Yeah. All right. 60 seconds of delayed cord clamping is long enough. That's our next. Is it a myth? Is it true?
Well, it's definitely better than immediate cord clamping. That is good. But there is the myth that no good happens after a minute. Like there's no extra benefits after a minute. And that is absolutely not true. That's when they stopped the research. They stopped it at, okay, we're going to do 30 to 60 seconds. They didn't do research for 3 minutes or 4 minutes or 5 minutes. The vast majority of it said 60 seconds is good. And part of that I understand. They're saying, hey, if we tell doctors to go from immediate to 5 minutes, it's never going to happen. So it's kind of baby steps. Let's have them start with 30 seconds. Let's have them go to 60 seconds. And then hopefully in the coming years, we'll get them to 90 seconds and 2 minutes. And then just, how about we do it when the cord stops pulsing? That's what the vast majority of out-of-hospital midwives do. We clamp the cord when it's white and limp and there's no blood moving through the cord anymore. And so there is a great benefit. I have seen some cords go flat very fast. And I have seen some cords that at 10 minutes, you can still feel a pulse going through it when you hold on to it. So for us, we wait till the cord is done pulsing and has done its job.
Okay, so we have definitely had a lot of nurses and doctors comment on some of our videos about letting the cord stay connected longer than 1 minute. And they often will say, but the research shows that 60 seconds is plenty. And so what you're saying is that, sure, research shows that 60 seconds is good, but there is no research about beyond the 60 seconds. So
exactly. They haven't done 5-minute research to say, hey, what is the difference between 1 minute and 5 minutes? They've only done it from immediate to 1 minute.
Right.
That's it. You know, so there might be like a couple strangling researches out there, but you need to have it repeated over and over for it to be solid research. And there's just nothing out there that has been repeated over and over to prove this.
Right. And that's in comparison to history over centuries where they used to just let it be until it was, I mean, I don't think they even thought that much about it. It was just standard, right? Let it keep pulsing or keep it connected until it's done pulsing.
Exactly. So my mother-in-law is a nurse. And when I started into midwifery, you know, we had the big argument. It was before the research came out about delayed cord clamping. It hadn't hit the hospitals yet. There was research, but it hadn't hit the hospitals. And she was like, no, you have to clamp it immediately. It'll cause all these problems. And I was like, I'm just not seeing any of these problems that you are talking about. You know, in all of my internships and starting my own practice, I'm not seeing any of this that you guys are talking about. And finally, arguing with her is, kind of what it is. And I finally said, listen, if we were meant to cut cords right away, we would birth a baby and a hemostat and a pair of scissors and then a placenta. And she stopped arguing with me at that point. Maybe she thought I was crazy, but also I just don't think nature screwed up that way. Nature makes mistakes. We have cancer, we have, genetic malformations that happen. But, nature didn't just go, and you can say nature, you can say God, you can, however you want to classify it. I don't think they went, oh, crap. All right, listen. In about 1940, I need you guys to correct this mistake that's thousands of years old, okay? Because, man, we screwed up. Like, when we were creating the human body, we forgot about that cord. Yeah. No! Like I said, it doesn't, you have to look at what nature has. And like I said, nature makes little mistakes here and there, but as a whole, it works. Why are we messing with it? Well, because the resuscitation table's on the other side of the room. That's where the resuscitation team is. That's where the pediatrician is. And the pediatrician doesn't want to get in the mom's way because they deal with the baby.
I remember watching a Rescue 911 back in like the 90s about a mother was delivering in her car and the husband was like helping and telling him that he needed to like take his shoelace off so that he could clamp the cord, like it was some urgent thing that needed to be done before the ambulance got there, which I'm sure the ambulance was coming pretty quick anyway.
Right.
And seeing things like that also in movies and things gave me the perception that there was, for some reason, a need to get that cord clamped.
Right.
But if you think about it, like what in the world would the reason be?
Well, and what benefit does that have over a dirty shoelace?
I know.
So now we have to give the baby antibiotics because it's had a disgusting, dirty shoelace. Oof.
Yeah. It's just this cultural misconception.
Myth. Yeah. Exactly.
Okay, the next one is kind of following in the tails of that, and that's the belief that delayed cord clamping isn't normal or standard. It's like the exception to the rule to delay clamping the cord.
So let's talk about normal and natural. Okay. So it's normal in the United States for women to have an epidural, but that doesn't mean it's natural. And
we're going to get a lot of people hating us for that. I agree with Heather, by the way. We can talk about that in another video.
Because it is an intervention. And so it may be normal to clamp the cord quickly, but that doesn't mean it's natural. That doesn't mean that's what should happen here. And we have to define these things. Like they took premature babies and they said, oh, we're going to have to lower their hematocrit because what we consider normal isn't normal for newborn babies. Well, it's not normal because they're doing early cord clamping. Or like twins. Let's talk about twins. Just because there's two babies doesn't mean for some crazy reason those babies are going to progress faster and their lungs are going to, like, there's still two babies. And so they say, oh, well, twins are term at 36 weeks, but a singleton is term at 40 weeks. They're only term at 36 weeks because you're not giving diet advice to these moms. And the body says, I cannot support two babies anymore. I'm evicting you. You've got to get out. And just because we've made it normal does not mean it's correct, that it's right, that it's natural.
Right.
And that's what we're looking at with cord clamping is the medical world has made early cord clamping normal and delayed cord clamping not the norm. But if you go into the midwifery world, delayed cord clamping is the norm and early cord clamping is you're crazy.
Right.
So, that's not the norm because we shouldn't be doing early cord clamping. And so I guess it's who you ask. Because for us, delayed cord clamping is normal.
Right. And yet here we are talking about how you need to do delayed cord clamping. It's the exception. It's, do something different than what your doctors do. Whereas the doctors, what they're doing is the exception from what they should be doing, at least according to history and nature.
Exactly. And you have to look at interventions in it too, because there is the exception to every rule. Okay, we've talked about that. We'll continue to talk about the exception to every rule. And if you have a woman that you are giving high doses of Pitocin to get contractions going, and then you're keeping that Pitocin on a high drip right after baby's born, the uterus is going to contract more than it naturally would have, which is going to force blood faster. So you have to look at the different variables with this. You can't, there's not just because the baby was born vaginally doesn't mean there aren't a ton of other factors.
Right. But what we don't want to do is make the exception the norm.
Right.
The next one is you can't do delayed cord clamping if you are going to save your cord blood for blood banking.
There's a little bit of half truth there.
Okay.
So I would not do an extended delayed cord clamping because once again, a third of that blood volume goes to baby that's in there. But we do want a little bit of that. So you definitely don't have to do immediate cord clamping, but the longer the blood sits in the placenta, it can be difficult to get enough blood for cord banking. I have found that, that minute, even sometimes a couple minutes is like, I can still get enough blood. So you don't need to do immediate. You can still do the medical terminology of delayed cord clamping, but I wouldn't be doing an hour long delay.
You do need to save some of the blood to save and store.
And it's just harder to get out because all the blood vessels start to shut down and stuff. Yeah.
Okay. The next one we're going to find is this truth or lie. Hospitals will always respect your request to do delayed cord clamping. And
you said that we've had a lot of moms say, that is not the case.
Yep, I'm asking the question because we've had a lot of women comment on our videos that they were very specific and they were told, yep, we will wait, but then they clamped anyway.
And part of the problem is you're going to have a lot of people in that room that don't know your wishes. So you have your doctor, but maybe it wasn't your doctor. Maybe it wasn't your midwife. Maybe it was one of the 7 or 9 in the practice. And so they don't know your wishes. You have your nurse and you've told her your wishes, let's say during labor, but now another nurse came in to join her or a student doctor. So when I was a doula, I was at a birth in the hospital with a mom that wanted delayed cord clamping. And the doctor was like, no problem. Sweetest female doctor was like, no problem, I can do this. And the student doctor was just really gung-ho. It was like the 5th birth she'd been to. And so she had the cord clamp ready in her hand because that was her job as the student doctor or the med student. And she went to clamp the cord and I was the one that noticed and I was like, no. And then the dad saw what I was saying no to and he was like, no. And we scared this poor student doctor to death. And the doctor was like, and so she looked at the doctor like, what am I doing? And the doctor was like, they want to do delayed cord clamping. And she had the most confused look on her face, like, we do delayed cord clamping? But if it wasn't for us watching that med student and being aware and like my job is to make sure that cord is not clamped under any circumstances, she totally would have clamped it and nobody would have noticed because they're focusing on the baby, the joy that they just had this baby placed on her chest. And so chances are you're going to get someone in the room. You may get a nurse that says, I don't believe in delayed cord clamping, so I'm just going to smile and tell you, sure, no problem, and then I'll clamp it. I've heard stories like that on multiple, not just cord clamping, but vitamin K, eye ointment, many, many different things where they're like, I'm doing it whether the parents want it or not.
Wow, because I know best.
Exactly. So you have to.
And then there's also the issue of you really need to specify what you mean when you say delayed cord clamping because most hospitals consider 60 seconds delayed cord clamping. So
exactly.
We've had someone say, no, they clamped it immediately. Maybe they didn't. Maybe they actually waited 60 seconds because that's not a long time. When you just barely gave birth, that can go by so fast. Maybe they didn't notice that they actually did wait 60 seconds. But if you want them to wait longer than 60 seconds, you can't just say, I want delayed cord clamping, because they'll say, okay, and then they'll still clamp it at 60 seconds. So if you're wanting to wait till it's done pulsing or at least wait 5 minutes or whatever your choice is, you need to be more specific about it.
Honestly, I would have somebody like your doula, your sister, whomever, that their one job the moment that baby is born is to started a clock, like,
Yeah,
you know, keep track. And all they do is look at that cord and they'd be like, it's been 30 seconds. It's been 60 seconds. It's been 90 seconds. Like, say it out loud. Because when we first initiated it at one of the hospitals I worked at, they did immediate cord clamping, drove me crazy. And the doctor, once they initiated it, he had to follow the rules. And I'm not even kidding you, at 35 seconds, because I was watching the clock, because I did not believe this doctor was going to do delayed cord clamping. Like, I knew this doctor and I knew he was going to fight it tooth and nail. And I looked at the clock, and at 35 seconds, he turned to everyone. He said, "It's been a minute, right?" to everybody. And I was like, And because he wanted to clamp the cord. He was like, this is the stupidest thing to wait a minute. He saw no benefit in it whatsoever, even though the research was there to back it up.
Yeah. So. And this obviously depends where you're going to give birth, but that's the thing. You don't know exactly, even if your hospital says, yeah, we'll do the delayed cord clamping. Maybe they will, because a lot of them do. Right. But unfortunately, we've heard from many, many women say they told me they would and they didn't. So I think it's ideal to, just like Heather said, have your birth support person, someone who's going to be in there, but could you just make sure that they actually do delay it?
And at a birth center, a freestanding birth center, not a birth center connected to a hospital, not a labor and delivery unit that they call a birth center, but a freestanding birth center or a home birth, the chances of them not doing it are very small. I'd still ask, but your chances are incredibly small that they would not do delayed cord clamping.
Can you do delayed cord clamping with twins?
Yes and no. It's another one of those. It depends on the situations. If you have, so there's what's called mono and di. And mono means babies share a placenta, they share the sac. Basically, you're looking at identical twins. And then you have mono-di and di. And di is they have two separate placentas, two separate sacs. You've got two babies that they're siblings, but they're not identical at all. And then you have mono-di, which is a combination. So if you have a risk of twin-to-twin transfusion, which is in mono, it is you have an increased chance of, if you don't clamp the cord, if you wait a long time, more than 30 to 60 seconds, the one baby will steal the blood from another baby. And so they typically do cord clamping pretty quickly in that case, so that the second baby doesn't steal first baby's cord, or vice versa doesn't happen. But in di, where they have separate placentas, separate amniotic sacs, they're just two separate babies in the womb, you can absolutely do delayed cord clamping with that, because there's no risk of that one twin stealing blood from another twin.
Okay. So yeah, that's good to know.
And the other thing is once again, the definition of delayed cord clamping. In the hospital, twins usually come very quickly because they force the second twin to come much faster. And so they want to get that first baby out of the way, where in a birth that is more natural, not rushed, the second twin usually comes greater than 5 minutes after the first twin. So you have more time. You're not trying to move that first baby out of the way.
Right.
So that's kind of the situation. You have to look at what kind of pregnancy is it? What kind of twins? Are they mono, di, mono, di? Yeah.
Is it best to wait several hours before clamping the cord?
So I do have people every once in a while that say, hey, can we cut the cord at the newborn exam, a couple hours after birth? And if they want to do that, we are happy to comply with that request. Once the cord has finished pulsing and the blood exchange is not happening, there's not a big benefit really to having that cord be attached for so long. I have not found any reason in the negative, that it's dangerous or anything. What I found is more of an inconvenience. So we put
inconvenient.
Exactly. We put ours in a gallon Ziploc bag, because you can kind of zip it up except for the little bit, where the cord is coming out. And one thing that I'll ask when we hand the baby to dad, like to get mom out of the tub or, to situate mom, that sort of thing, is I'll say, do you want a baby or do you want a baby and a placenta? And I'm telling you, almost every time they look at me and they go, what? And I'm like, if you want to wait, I need to give you the baby and the placenta, and you have to pay attention to this placenta because I don't want it falling out of your arms and dropping on the floor and snapping and, all these things. And so I'm asking, do you want a baby or do you want a baby and a placenta? It's your choice. And most of the times dads look at me and they go, I'll just take the baby, please. And I'm like, okay, how about we cut the cord before we get out of the tub or, before we hand you the baby.
Get situated, yeah.
Right. And the question they usually ask is, well, is the cord done pulsing? And I'll say, here, put your hand here. You can hold on to the cord. You can see how white it is. And I'll kind of, talk them through that. So yeah, you can definitely. Now, one thing I have noticed, I've not done any research on this. This is just my own personal, is the longer a cord is delayed being cut, the faster it falls off. And honestly, I don't know why that is.
Meaning off of the baby's
Yes, exactly.
belly button.
Like the days later. So if I have somebody that waits an hour, 2 hours, I find that the cord usually comes off in about 3 days, where the hospital birth babies, where they have clamped it immediately, it's staying on there for about 7 days that the parents are having to take care of it and clean it and all that. So, and that's just
true.
something
It is
I've
nice
noticed.
once it falls off and you don't have to worry
is.
as much about it.
It doesn't catch on the diaper or pull or
Yeah.
irritate the skin around it. So, antidotal. But I found that most of our moms, the cords on their babies fall off around 3 or 4 days.
Okay. So that leads us into the last question, which is lotus birth dangerous? And actually, you better explain to us what lotus birth is to start out.
So lotus birth is when you never cut the cord. Baby doesn't get separated from the placenta until the cord falls off the belly button. And typically what they do with lotus birth is they will put it in a bowl and rub it with salts and herbs, kind of jerking it, kind of preserving it. Preserving it, right. I don't know how to explain it.
Like you would preserve meat. Yeah,
exactly. It's the salt of meat. And so every day, once or twice a day, they'll rub it with the fresh herbs and the fresh salt and make sure that it's fine. I've had a few people that have wanted to do that, and usually at like the home visit that we do at 24 hours, they're like, can we cut the cord? Like this is good. Because and those cords usually fall off very fast, around 3 days, but you do have to take the cord, the placenta with you
everywhere baby goes, the placenta goes. They're still attached.
So mom and baby typically don't leave the bed area much at all, but it can get a little messy. Now it doesn't rot or anything. That's what the salt is for and the herbs are for. And the danger would be if you don't keep it clean. You have to keep it clean. You have to keep it preserved so that you don't have any infection happen.
I can just imagine if you have a toddler. Yes. How interested they would be in that placenta.
Yeah.
Can you just explain the history of lotus birth? Like, why is that a thing?
So to cut the cord, you need to have sterile scissors. I remember, oh my goodness, I was at a birth once. It was a home birth, and it was the mom's second baby, and she's in labor. I have, all of my instruments, everything, ready, the birth tray. And she said, did you bring your own scissors? And I said, oh, yes, And she said, are they sterilized? And I was like, yeah. I'm like, why? Can I ask why this is a question? Because to me, it's just common sense.
Like, of course
they're sterilized. They're in the package and they've been autoclaved and, and I'm like, that's just a very odd question. Can I ask you what prompted this? And she said, oh, well, our last midwife just went to the kitchen drawer. We're not going to call her a midwife, okay? went to the kitchen drawer and got some scissors and cut the cord. And so our baby had an infection and had to be on antibiotics. And I was like, oh yeah, yep, here's my autoclaved, pack.
Goodness.
Like I was like, oh my goodness. So one thing, and this is, I guess you could say my speculation because it makes sense to me. And I'm sure there's some story out there, showing. But if you didn't know about sterilization, long time ago,
Right.
and you noticed that every time you cut the cord, that many times those babies died, you would stop cutting the cord and you would do a lotus birth. And then as we figured sterile technique and, we figured out.
Learned about bacteria.
Exactly. Then we said, maybe we should sterilize these scissors so that we can cut the cord. So my assumption is that it came from babies dying because of cutting the cord in not sterile. So that takes us to candling. There are some people who will request that the cord be severed because it's not really cut with candles. And what you do is the cord is usually left kind of long, not quite as short. But once the mom and baby have settled in, you take tinfoil and you put it under a section of the cord, and then you take 2 candles and you burn the cord. It actually takes quite a while because there's a lot of popping and snapping and all of this. But it's a sterile way to burn through the cord, sever it, and cauterize it and not have that infection risk. And some people do
Does
it.
that smell bad?
It doesn't smell great, okay. But it's not as bad as you would think.
Okay.
But it's But the weird thing is because it's got moisture in it, so there's a lot of popping and sizzling kind of sounds, and you can't do it too.
You're searing it shut,
right? And you can't do it too close to baby because you don't want to burn baby, of course. So the baby will still have a bit of a long cord. But I've had a couple people request that, and it takes a long time. Like it's not, 60 seconds. It takes a good amount of time to be able to burn.
So that's just another thing that historically they did sometimes, and some people hear about it and then decide they want to do that.
It was safer because it ended up being sterile.
And that's something that, if you want to do either of those things, I don't have a problem with it.
Right.
But maybe just understand it is safe to cut the cord with sterile instruments and the way that it's handled these days. But and that's actually quite ingenious, I think, historically, that if they've noticed there's some problem with cutting the cord, so let's find another solution that was safer because they didn't know really what the problem was.
Exactly. So there aren't the risks to like the candling with the cord is burning baby and such. So you do need to be very careful and have someone who knows how to do it properly. Yeah. But different options for you if you want to try those different options out. And I'm more than happy to do that for my mamas if that's what they would like. I will say that I've only had it, just a handful. Most people are like, the placenta did its job. It's good. Let's move on.
Right. So. All right, before we end talking about cord clamping, Heather's going to share a story that will illustrate, this is a real story that illustrates the benefits and the importance of doing delayed cord clamping.
Okay, so years ago, I had a mom who was having, she'd had many children by this point, 5 or 6 children. And she called me at 35 weeks and said, my water broke. It's a very slow leak. So we verified that her water had broken. And I said, you really need to go to the hospital because you're 35 weeks. We shouldn't do a baby at the birth center at 35 weeks. So she said, okay. And I said, what hospital do you want to go to? Do you want me to go with you? And she was like, nah, I've had all my other babies in the hospital. I know how to, I'm good with the hospital. I've got it. And she told me where she was going. And I said, okay, I'm just down the road. I was actually painting our other birth center, getting it ready to open. And I said, call me if you need anything at all, and I'll pop right over. She said, okay. And so it'd been a couple hours. And I was finishing up painting, and the husband called and he said, they're sending us home. And I said, what do you mean they're sending you home? Like, her water is broken. And they said, they said her water hasn't broken, and that she needs to get a real ultrasound. I'm like, a real ultrasound? She's had medical grade, like, what are they talking about? And he's like, they were just really derogatory towards us, that we weren't having our baby in the hospital, you know, the blah, blah, blah.
Or that wasn't the plan originally.
Right, that wasn't the plan. And so he goes, and I said, okay, well, tell me what else, like, what's your concern? And he said, they refused to check her, like any dilation or anything. And I was like, that's like mandatory standard. They should check her before they send her home. And he said, well, I asked the nurse, I said, because the nurse said, okay, we're sending you home. And he said, well, aren't you going to check her? And the nurse was like, no. And she goes, why are you looking at me like that? Like, the nurse said this to the dad. And he said, because she's having contractions every 3 minutes. Like, how do you not see that she's having contractions?
And her water broke a while ago, right?
And she said, well, I don't know what to tell you, but your water hasn't broke, and you're like, you're discharged. Just, I mean, was really rude to them. I was quite
Which is the weirdest thing to tell a mom your water hasn't broken. I mean,
especially when she's had multiple babies.
Like, I think she could tell.
Exactly. Because there are some times that moms think their water's broken and it hasn't. But we knew her water had broken. And so they called me at the car, and the mom was crying. And she said, it has taken me 10 minutes to get to the car because I'm having so many contractions. What do I do? And they wouldn't accept her at labor and delivery. And this was a family who was not passive. Like, they were used to, you know, getting what they needed, but they just kicked them out. And so I said, you know what? Let me meet you at the other birth center. I'm just finishing up here. I'm locking up, because this birth center had no bed or furniture, so it wasn't ready. And I said, let me meet you at the other birth center. I will check you and we'll see what's happening. How does that sound? And they said, that would be fantastic. Thank you so much. And I said, all right. So I get to the other birth center, and my staff was already there because we had another mom that was coming in from an hour and a half away. So we'd already prepped the center waiting for this mom. And so I get there before them, and then they get there a couple minutes after me, and I check her, and she's complete. Like, she is minutes away from having this baby. And so I said, all right, do you guys want to try to go to another hospital that's near here? Like, I don't know if we'll make it because this baby's so close. And the dad just said, no, we're not going anywhere else. Like, how much time do you think? And I'm like, a couple contractions maybe. And the ambulance was right across the street from the birth center. So baby delivered, a couple contractions later. We kept the baby kind of low so that the blood could really get to baby. And that baby, it took about a minute. That baby cried. They were great. There were no problems, so we didn't need the ambulance. We didn't need the hospital. And I attribute so much of that to delayed cord clamping. And we knew her dates were 35 weeks. This is not, her dating was off or something like that. So I said, all right, I need you to go to the pediatrician before you go home. So I called their pediatrician, and I said, hey, they're coming in right now. They can't go home without getting checked out by you. And normally we check out baby, but being premature, right, I needed that second set of eyes. And so he said, no problem, have them come right in. They came right in. He said, yep, this is a 35-weeker. I can't believe the hospital sent you home. Dad called the hospital and said, we're not paying the bill. We're not paying any of that bill. And they said, why? And he said, because we had the baby. And he said, how many minutes after they left the hospital? And they were like, we are so sorry. Yes, you won't pay this bill. And the pediatrician sent him home, and it was fine. But truly, I believe cord clamping was or not clamping the cord right away was a huge part of that, because baby got that extra boost of blood and oxygen, allowed it time to open up its lungs. And like I said, baby did great.
Yeah.
It was great.
And there's no guarantee with the preemie of just doing delayed cord clamping is going to be all they need, but
exactly
in this situation,
it worked out well. But I really think we would have had a baby that had grunting and flaring and problems if we had done immediate cord clamping. But we had the resuscitation set up because she was on the birth stool. So we had like our resuscitation tray and then our birth tray. We had the warm towels, like we had everything ready. You know, we had 911 on alert. Not that they had much time, but they only had to run across the street if needed because there wasn't time to do anything else because of them sending her home.
And so. I believe that a baby born, do you know how much that baby weighed?
It was 5 or
small.
6 pounds.
Oh, okay.
Yeah, it wasn't too bad.
So it wasn't too tiny.
And she normally had like 8 or 9 pound babies.
Okay.
So it wasn't
because a lot of times in the hospital, a baby born at a certain weeks or below a certain weight, they automatically want them to go to NICU even when they're not always actually having issues, but just due to size or...
Yeah, it's usually under about 5 pounds, 8 ounces, right around there. It's a mandatory visit to the special care nursery or something, yeah. But yes, baby did great.
Okay. Well, we hope that helped you clear up some misconceptions about delayed cord clamping, understand it a little bit better. These are all things that are commonly out there on the internet if you go looking for it. And remember to check out our free birth class if you're interested in having a low pain birth.